Well, hello everyone, and welcome to our discussion on cognitive healthcare re-envisioned, as we would like to say. We're looking at an orthomolecular approach, that is a biochemical approach to the diagnosis and treatment of various disorders. I'm Dr. Albert Mensah, MD, BCIP, board certified in integrative pediatrics. Mensah Medical is our institution, along with the Mensah Research Institute. So thank you very much. This slide, I'm just basically going to share with you what these slides really are just kind of trying to illustrate here. First of all, what many people seem to forget or are not aware of is that the brain is a biochemical factory. And in order to make the right products, such as neurotransmitters, such as other chemicals, histamines, and so forth, you need to have raw materials like any other factory. And those raw materials for production involve nutrients, minerals, and amino acids. Okay. Without those key pieces, you simply can't make your neurotransmitters or other very important chemicals. So I want you to understand this first and foremost. The brain makes what it actually needs, but in order to do so, you've got to have the right building blocks present. And that's really the foundational piece to what we call orthomolecular medicine. Now, what if you don't have enough of certain key nutrients? Well, let's talk about some of the key nutrients that are really present or necessary, that if you don't have enough of them, you can have impaired brain function. The first one, and my favorite one of all time, probably is zinc. Zinc is involved in just a ridiculous number of chemical reactions, not just within the brain, but also the body. Agents like methionine, extremely important for methylation. Folic acid, also, but in the reverse, opposite from methionine. Vitamins B6 and B12, very important. Niacin and niacinamide, very important. Certain antioxidants like selenium, glutathione, vitamin C and E, etc., chromium. These are all very, very key elements that are necessary for appropriate brain function. Now, that previous slide talked about if you don't really have enough, they can be a problem. But certain nutrients, if you have too much of them, can also be a problem, and they can also impair brain function. So one of them is copper. That's a very, very big and important one when it comes to especially female health. Folic acid is another. Iron, methionine, also now certain toxic metals like lead and mercury and cadmium. First of all, they're not really toxic unless they're in too much of a quantity, okay? We need all of these agents. We just don't need too much of them. So when we have too much lead, too much mercury, too much cadmium, then we have impaired brain function as a result of it. Now, let's talk about certain imbalances that alter neurotransmitter activity, because we're all very big in the idea that, let's measure neurotransmitter activity, let's affect therapy, etc. But what about looking at the agents and imbalances that most people have that lead to disorders like ADHD, behavioral issues, anxiety, depression, bipolar disorder, and schizophrenia? Let's look at some of these. Too much copper or copper overload, UnderMethylation, OverMethylation. Now, many people don't realize that there is such a thing as OverMethylation. Well, this is called the yin and the yang of the universe. If there's under anything, there's usually an over something as well. And in this case, these two are diametrically opposed and treated the exact opposite way with good success if you know what you're doing. Pyrrole disorder, a disorder of biochemical imbalances where zinc and vitamin B6 are taken away. And what we didn't talk about before, but if you look at the need for zinc and B6 in order to make your neurotransmitters, pyrrole disorder can be significant. Toxic metal overload, severe oxidative stress. And for those of you who don't know what oxidative stress is, let me just tell you, this is like cellular rust. Oxidative stress is an inflammatory process that leads to dysfunction or functional breakdown of cells at just the micromolecular level. I want to just talk about some of the key symptoms that can happen when you've got too much copper present. Now, copper can lower dopamine levels and increase norepinephrine levels in the brain. So you'll oftentimes see things like schizophrenia, ADHD, bipolar disorder, postpartum depression, and even violent behavior. Now, the violent behavior is most often seen in males, whether it is older males or younger males, but Some of the key symptoms that are more exclusive to copper toxicity include things like aggression or violence, we just talked about that, hyperactivity, especially as children, impulsivity in a young male especially, or in a female, usually has the underlying undercurrent of copper toxicity present, okay? Bad behavior in school, history of physical assaults, those are some of the key things you'll actually see. So let me give you a simple example. If you have a young male who seems to be in trouble all the time, who's impulsive, who's agitated, you probably want to check a copper level on these young folks, because quite often copper toxicity is involved. Now, I just want to share with you the idea of methylation in general, okay? Basically, methylation involves a process. It is the process by which methyl molecules, that is a carbon with 3 or 4 hydrogen atoms attached, will actually bind to an enzyme, a hormone, or a neurotransmitter, and then turn them on or turn them off. Remember the factory, okay? The brain is a biochemical factory. It makes these products, but doesn't make them in the active form or the inactive form. You don't get a product from Amazon shipped to you, turned on already, or turned off. You normally have to go get batteries, or activate whatever that thing is, okay? So the same with the human brain. It makes agents, but then you've got to turn them on. Methyl molecules turn on and turn off enzymes, hormones, neurotransmitters. So if you have too much or too little of these very important methyl groups, that can cause an imbalance in both structure and function of your system. Now, overmethylation, this is where you can see high anxiety, depression, toxic chemical foods. This is where you've got way too many methyl molecules. In other words, you may be hyperstimulating the system, as opposed to with undermethylation, where you're not appropriately giving enough stimulation to your system. With overmethylation, you can see high anxiety or panic. You can see nervous legs and oftentimes pacing. Many individuals are very, very depressed. They can have a severe adverse reaction to SSRI medications in particular. These overmethylators though, tend to have a very high pain tolerance or high pain threshold. So you may see them in sports where they can run up against a wall and then just kind of walk away and they're just fine, seemingly anyway. They oftentimes have low motivation in school. Their performance may be subpar, but they're usually highly intelligent individuals. These are the people who kind of sit back and say, well, I can certainly score in the 99th percentile of any test you give me, but I have a D average in school. And you ask, why do you have a D average? You say, well, look, I just don't feel doing homework is important. Does it mean that they didn't learn the material? Absolutely not. These folks can usually process things faster than most other individuals. They just don't care. So you don't see the achievement, but the intellect is certainly there. Let's talk about undermethylation a little bit here. Individuals who are undermethylated will oftentimes manifest their particular disorder in terms of eating disorders, obsessive compulsive disorder, perfectionism, and even schizophrenia. They tend to have OCD tendencies. They have a very low tolerance for pain on average, unlike the overmethylators who have a high tolerance for pain. They oftentimes have a prior diagnosis of OCD or ODD, that's oppositional defiant disorder. They can have very ritualistic tendencies. They can be very strong-willed. They can be extremely competitive. Some of our greatest athletes in sports are usually undermethylated people. They're just perfectionists. They have to go out and destroy the competition. You can also see typically a very powerful family history of high achievement. Individuals who say, well, I'm the 14th generation of people who went to Oxford or went to Harvard or went to the University of Glasgow or wherever it is. And they're usually telling the truth. But we often see that because of the perfectionism and the undermethylation that is passed down from generation to generation. Now, you need methyl molecules in order to actually make muscle. So if you're undermethylated, many of these individuals you'll see are typically very slender in their physical appearance. So it's not just about cognitive capacity, it's also about physical symptoms and physical size that gives you clues as to what a person's methylation status might actually be. Now, They're also very highly addictive. You can't have this proper methylation regulation going on. And so people can be, well, should we say, prone to more addictive challenges like smoking, like drugs, like even sexual addictions. A lot of addictive behaviors are seen in undermethylation. Pyro disorder. Now, this particular slide has got a great deal of information here, but basically, pyro disorder is a disorder of stress intolerance. And the more stress that's around, the more individuals will become difficult to regulate in terms of themselves and their approach to other people. Road rage is an example of instant pyroluria, going from calm to rageful in the drop of a hat. People with pyro disorder have sensitivities to light or sound or odors or textures. They may go from calm to rageful. They can have anxiety and depression. They can cycle very rapidly, several times a day, through these different mood states. In fact, many individuals who actually have pyro disorder are oftentimes misdiagnosed with a psychiatric condition known as rapidly cycling bipolar disorder. And guess what? It's not true. They actually have not a mental health issue. They've got a biochemical, physiologic health issue. Well, toxic metal overload, we kind of all have an idea of lead and cadmium and mercury poisons and things like that. And so I'm not going to spend too much time on it, but one of the key things here is that these toxic overloads can inhibit or shift the functional capacity of certain key regulatory proteins in the human body and in the brain, known as MT proteins, also known as metallothionein proteins. Those are the proteins that work to basically detoxify your system and to keep you functioning properly. Oxidative stress. Those are the two words that are gaining a lot of momentum here in the United States and around the world. Oxidative stress is seen not just in physical disorders, but in most mental health disorders as well. Excessive release of free radicals, that's what we're talking about here. Free radical release destroys or at least hinders appropriate biochemical processes. Okay? We see oxidative stress throughout autism. We see oxidative stress throughout gut disorders that involve casein and gluten and inflammation of the bowel. We see oxidative stress can lead to poor immune function. Now we're talking about COVID currently. And COVID is wreaking havoc with systems in the human body, not just chemically, but also with regard to inflammation and oxidative stress. So dealing with oxidative stress is absolutely necessary to make sure we regulate immune function and cellular function, period. No matter what the cell is, a brain cell, a gut cell, a nerve cell, oxidative stress is very key. So it's important that we recognize it. I like to call it cellular rust. There are environmental and what we call epigenetic influences. So just to make this kind of very simple, what is epigenetics? Epigenetics is where the environment affects how a gene will behave. So you may have a gene for being very calm, so to speak, but then something happens in the world and now that gene is either turned on or turned off. And now what is in your genetic blueprint doesn't really show up in you, okay? The way I like to look at this is that we've got 20,000 genes in our DNA, but not all of them are turned on and not all of them are turned off. We can see this switching on and off, or gene expression, if you will, happening throughout our lives, and many of us don't even recognize it. So you start off your whole life eating corn, eating gluten, eating all sorts of things, and you have no effect whatsoever, you're just fine. Then one day you turn around in your 40s, and all of a sudden your brain starts to get foggy when you eat gluten. Well, what happened in actuality is that a gene either turned on or turned off, affecting your capacity to deal with gluten. And it happens to a lot of folks. So this is why we have to be very careful about genetic testing. Genetic testing tells you what your blueprint says is supposed to happen, but biochemical testing tells you what actually is happening, because epigenetics comes into play, and that's the difference between your chemistry versus your genetic blueprint. Okay? We talk about diet and gastrointestinal issues as well. So people can have food allergies or food sensitivities. There's yeast overgrowth, which can lead to alcohol intoxication inside your own system. We have casomorphines and glucomorphines. We have an imbalance between good and bad bacteria. We have sugar issues, hyperglycemia, malabsorption, and poor digestion. All these things can affect mental health processing, mood, and even the point of irritability or rage, okay? Hypoglycemia is not a fun thing, not just for the person who has it, but for the poor people who happen to be around that person. So let's talk about the idea of the orthomolecular approach to treatment. We're talking about an all-natural, that is a non-pharmaceutical approach to treatment. This is not just generalizable. This is targeted nutrient therapy. I'm going to actually call this molecular treatment, molecular targeting, and molecular targeting agents, or MTAs. We look at molecules, we see exactly what's going on, where things should be, how they're aligning, and if they're not, we seek to re-regulate them in that direction. This is our singular treatment modality at Mensah Medical. 85% of our patients significant improvement, if not total elimination of their symptoms. Now, what happened to that 15%? The 15%, 10 of that is usually non-compliance. People aren't doing what it is we ask them to do the way we want them to do it. Or they actually get doctors all giving them several different things that clicked and nobody knows what is going on. Now, it's true, about 5% of people are kind of recalcitrant to our treatment process. We don't know why they don't do better. It's only 5% though. 95% have got great potential. So when we look at our evaluation process, first of all, we ask the question, what is out of balance? Is there a nutrient overload or is there a nutrient deficiency? We look at metal regulation and metal dysregulation. Metals are not necessarily a bad thing. We need metals. Calcium is a metal, okay? Zinc is a metal. Those are vitamin D. Well, vitamin D is not a metal, but they're all necessary and key elements. And so we want to make sure that they're being regulated properly. There are environmental and epigenetic factors, as we talked about before. Gut issues, GI issues, including food allergies, sensitivities, and malabsorption. Those are things we also investigate. Now, we test for methylation disorders. We use a very simple method to evaluate methylation. Methylation, or methyl molecules, and histamine have a diametrically opposed relationship. When one is high, the other is low. So we make it very simple. Forget genetic analysis, so to speak, as an initial construct. Let's get a histamine test. If it's high, you're undermethylated. If it's low, you're overmethylated. Treat the patient. See, folks, you're out there, many of you are just way too smart for your own good. Keep it simple, and you get much better success. Then there's pyro disorder. Very, very key agent, not just because of mood dysregulation, because of oxidative stress and inflammation as well. Very, very important things here. So our treatment, first of all, we would look at a physical examination when in person, an extensive patient history. History tells you everything you really need to know. It points you in the right direction for sure. Specialized laboratory testing with blood and urine. We look at diet and gastrointestinal issues. And then we put together an advanced nutrient protocol, which I'm going to also call advanced molecular targeting agent protocols, that are prescribed at therapeutic levels to target the patient's biochemical imbalances. Absolutely necessary to correct the underlying disorders. Now listen, you can't just give a nutrient and hope it's going to work. This is about as specific as pharmaceuticals are. You need to have the right dosing as well as the right agent. If you don't have the right dosing, as my business partner, Dr. Judith Bowman, would say, right stuff, but not enough. Have to keep that in mind. And then we've got to have follow-up care. So you don't just start a patient on the program or the process and then say, well, thank you, goodbye. No, there have to be adjustments made. You have to see how the patient's doing over time. And that's where our physician follow-up care and our nursing follow-up care come into play. So the benefits and the risks of nutrient therapy. First of all, the benefits, it's all natural stuff. Minimal side effects. Most of them have to do with how well your stomach will tolerate nutrients, especially if you don't eat when taking the supplements. This is also complementary to traditional medicine. So no one is saying you have to stop doing your traditional stuff. We're just saying, let's fix the underlying problem while we're doing that. It is customizable to the individual person's biochemistry. This is not a general product that anyone's trying to sell you. We don't even do that. It's also typically less expensive than pharmaceutical treatments. This is based upon decades of research and treatment history. This is not new, not in our world. Our institutions have been doing this for over 40 or 50 years. We were the pioneers involved in this whole process. We have an 85% success rate, as I mentioned before. But the key here is that these nutrients, these molecular targeted agents, must be prescribed by an experienced orthomolecular physician. The evidence is out there, and it continues to grow. I'm Dr. Albert Mensah. You can visit us at our website at www.mensahmedical.com or www.mensahresearch.org. Our main clinic is in Warrenville, Illinois, and we have patients from all over the world. Thank you very much for your time.